So Richard, we are here to talk about your journey with
Yes.
MMN. Let's start at the beginning. Can you kind of frame where you were in your life when the whole MMN journey first began?
I was 44 years old, just got plugging through middle age, 3 teenage daughters, real busy, intense job, married, and I started experiencing some pain and some soreness in my right shoulder. And it wasn't like an acute, real sharp pain. It was just kind of a nagging, bothersome pain that I just ignored at first and kind of worked through, but kept getting worse and worse and was really inhibiting my ability to work out. And so I thought it was a sports injury. And then I went to see an orthopedist, and they very quickly gave me a shot of cortisone, also thinking it was a sports injury. The cortisone did absolutely nothing. And my symptoms by then were starting to get a lot worse.
Can we talk about that progression?
First, there was some muscle atrophy in my tricep. Looked like the muscle was just very flaccid, almost just like hanging skin. And then I had drop wrist and muscle atrophy in my right hand. And really just extreme weakness there that limited me and really restricted me in terms of activities of daily living. Things like writing, shaving, typing, picking up a cup of coffee just became almost impossible. I'd have to wake my wife up in the morning so she could button my shirts. I had to get dictation software at work because I was no longer able to type. So just extremely limiting.
So as the symptoms progressed in the beginning, you were able to ignore them, and then you kept making all these sort of adaptations.
Exactly.
And how about in your lower body?
That was a scary moment when I noticed the progression to my lower body. I was jogging in late 2018 and didn't have any strength in my left leg. And I thought, this is weird. I didn't have any injury, and it wasn't a cardio issue. And then a couple days later, I was getting undressed and looked in the mirror and saw that my left quad was about half the size of the right one.
So you were feeling it on the inside, but observing it on the outside too.
And then just kind of the background impact on, I shouldn't say background, really foreground impact on my mental health, and just seeing myself get weaker, seeing myself waste away, and just the feeling that I'm not there for my family and not able to do all these things that I used to be able to do. That was very frightening.
So now you're seeing the neurologist.
I went from the orthopedist to a community neurologist in central New Jersey in the U.S. where I live. Over the course of the next few months, they did 3 or 4 different EMG tests. 6 or 7 MRIs were done. Not sure how many vials of blood were drawn. Separately, I was seeing a chiropractor, an acupuncturist for symptom management, a rheumatologist, thinking maybe this is tick-borne. So I'm just kind of grasping for straws. And the neurologist that I was seeing locally, I think, was struggling as well. And he eventually suggested that I get to an academic center of excellence. Went there for a physical exam first and back the next day for an EMG test. And after the EMG test, the provider walked casually into the exam room and kind of matter-of-factly told me that I had ALS. And that, as you can imagine, just rocked my world. It's a terminal illness, 3 to 5 year life expectancy, a couple approved FDA therapies that do a little to manage symptoms, but don't really alter disease progression.
What drove you to keep pushing?
The big thing that drove me to keep pushing is that there's no clear diagnostic test for ALS. EMGs, of course, go a long way towards hinting at what it could be, but there's no biomarker, no blood or imaging that can be looked at to determine, whether it's ALS or not. So I sought a second opinion. They did not do an EMG there, but the physical exam that they did led them to confirm the ALS diagnosis. Then I ended up getting a third opinion. They did their own EMG test, and it was real thorough. And we got done with the EMG, and we're walking back to our hotel room, and my cell phone rings, and it was the neurologist I was seeing there. And we waited in her office for a couple minutes, and she came in and said, "I'm going to cut to the chase. We don't think it's ALS. It's something called multifocal motor neuropathy."
So have you counted how many physicians you saw from the beginning, from that first orthopedic visit?
I've counted the number of neurologists, and that's 7, from the first community neurologist up to the folks at the Mayo Clinic. And I would say probably close to 2 dozen, close to 25 physicians and healthcare providers along the way.
And how about having conversations with that your neurologist, your quarterback, as you call him? Do you use any type of trackers or indicators?
Yeah, when I do talk to my neurologist and he asks me how I'm doing, the answer is usually very qualitative in nature. I'm doing great. I'm doing well. No issues. But I don't have any hard data points or any measures that I can point to and kind of have a discussion with him around. I think having those more data-driven, quantitative discussions are going to help those patients better manage their condition and kind of really land on the right therapy for them.
Thinking about the future, what would you want neurologists to know about multifocal motor neuropathy today?
I would want neurologists, and thankfully the one that I see does treat me this way, to really think about the whole individual and kind of what are my goals as a person, and what do I want to do in terms of work and with my free time, and how do we achieve that? Really think about the mental health burden and our patients getting the right resources there. Really the neurologist kind of being the quarterback for the patient and thinking about them holistically, not just the medication and treatment.
Treating the human, not just the disease. Let's talk some more about the future.
As a patient, it's a great time. There's some work being done looking at potential biomarkers for MMN, which I think are greatly needed in terms of kind of accelerating and creating a more accurate diagnosis process, and also giving physicians and patients tools with which they can better monitor disease progression. There's a lot of innovation out there, and just looking at some potential new therapies that are being investigated, that wasn't happening 5 years ago. So as a patient, I'm extremely appreciative, extremely excited about what that innovation could mean going forward.